That actually is a very nice entry into the next topic that we want to talk about. That what is the landscape of technology in healthcare in India? So, as we look at the health tech adoption in India, we are seeing two extremes. On one side, there is rapid innovation in urban centers, but then on the other side, rural areas are still struggling with basic medical sciences. So, sir, where do you think India stands today in the digital health journey, and where we need to go? What more we need to do to be at a good place?
Talking about the current digital health in India, we have the National Digital Health Mission, NDHM, and the Ayushman Bharat Digital Mission. So
Hmm.
this was launched to create a patient-centric digital healthcare mission. So many people are not aware of it.
Hmm.
So this was started in 19 in 20 2020,
Okay.
and so after COVID, a lot of digital health by the government is emphasized, and and a lot of developments is going on in the Ministry of IT along with the health department. Now, we also see a lot of the role of startups, in health tech, since we have a lot of problem statements to solve.
Yeah.
And looking back, like as per the latest data, we have got more than 12,000 startups, health tech startups in India. So that's that's good to know. And we also have a few like unicorns in 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 the health tech startup space.
Mm-hmm.
Then we so in the times to come, since we see a lot of uh, developments in technology. Recently, we had Blackstone being like involved with a large real estate developer to
Hmm.
set up the largest data center in Mumbai. Last week it was announced. So we seeing a lot of new developments, data
Hmm.
centers being set up in India to store data. So obviously, with AI and all, with new projects coming up, so we will be needing a large data storage. And then
Correct.
talking about the digital divide, we see like internet, as you know, is there, but still there are some areas where like internet and all is not there, and digital infrastructure has to improve so that
Hmm.
everybody can have high speed internet, and then
Right.
and obviously with the rising like income level, then they can have a affordable device. S- the good thing is that we see smartphones being used, like WhatsApp being used by majority of population,
Correct.
and but obviously with less income, people are still like using the old uh, smartless phones, like you can tell, the old uh, button phones. We see that the uh, current government is launching different schemes like healthcare schemes, like Ayushman Bharat is there, where like each and every people below a particular income can get
Hmm.
insurance, like which is not earlier, and it is very easy to avail it. Just like you need to have the Aadhaar card and the ration card, so that
Right.
it checks for your citizenship, and then based on that, like you get like healthcare. And then we see that AIMS, the top medical institutions in India, similar to the IITs, it is there in like almost like each and every state. So the cost of healthcare will come down, but with a lot of population in India, that obviously like it is a huge challenge to
Yeah.
overcome the healthcare needs of the population. But with times, with technology, and with like improving digital infrastructure, the cost of healthcare will come down, and uh, uh, later on, just like we see like WhatsApp being used by almost like everybody. So similarly, healthcare access will be there for everybody.
Yeah, correct. I think that's I think very accurately answered. Where uh, of course, government is putting a lot of effort in creating more and more institutions in every state and even regionally. But I mean, and like you said, even though there's not like wired internet available everywhere, but there is wireless internet now. Where people are using mobile phones, smartphones. So by having these technologies that actually makes all the new exciting things that are happening, the latest research happening, really more available, more accessible to people in the rural areas, and especially like people who are speaking their own regional languages. If we talk about therapy, by having projects like Bhashini, like you mentioned, this therapy can be really be available from tier one, tier two cities where there are more providers, where there are more therapists that can really be available for people who are in rural areas. So with technology, we think that there's more divide, but I think there's less divide. We are actually removing that divide or closing the gap between that divide. So
Right,
amazing.
right.
Yeah,
And obviously, like Bhasani was created so that to remove the regional language barrier, so that
right.
like you just need to know one language and other things are taken care of. Your
Hmm.
communication with other parties is taken care of. So similarly, with new like applications or new technology will come, which will minimize the digital divide between the uh, the low income groups and the like high income groups.